Hi friends, today we're going to discuss about mental health care management system, an innovative solution from Karnataka state government. Myself, Dr. Suresh Padadmat, Professor of Psychiatry, Head of Telemedicine Centre, Head of Forensic Psychiatry Unit at NIMANS, Bengaluru. Before I start my presentation, I would like to have a disclaimer. Basically, this presentation is for academic and awareness purpose only. This is not a legal opinion. If you would like to have a legal opinion, please do contact an advocate. And the conflict of interest? None. This mental health care management system was initiated by Government of Karnataka as a project mode, and I was the principal investigator, and the co-investigator were Dr. Naveen Kumar, Dr. Manjunath, and Dr. Girish Rao. And of course, the equal partner was IIITV, Dr. T.K. Shrikant, and also Mr. Divyaraj were there with us. And of course, to place it on record, the important person I would never forget is Shri Ajay Seth. He is the one who gave unconditional support, and he was there for each meeting when this program was planned. And equally supported by Javed Akhtarji and another person, Dr. Shri Ratan Kelkar, Director MD NHM. Along with this, the Deputy Director Rajini Parsarthi played a major role in executing this project. Of course, this project was funded by none other than Department of Health and Family Welfare, Karnataka State Government. This is the landing page of mental health care management system. The primary objective of this project was to have a digital registry of persons with mental illness, basically medical record, and to develop a central repository of mental health establishment and mental health professionals. To have an innovative system which will govern the implementation of Mental Health Care Act of 2017. This was the primary reason when this project was executed. And again, to place on record, Shri Ajay Seth ji was there and he formalized these primary objectives. And with the vision of IT-empowered system for management of mental health care services on a secured platform of National Informatics Centre, that is NICIN. Accountability and transparency from all the stakeholders was also planned to do away with the manual registers and to simplify the data entry. Comprehensive care using unique ID of Ayushman Bharat and Arogya Karnataka ID. Integration of community-based services like helpline, ambulances, and CADS. CADS is nothing but care at doorsteps. At the same time, the main aim was implementation of Mental Health Care Act 2017. Along with that, registration, storage, and retrieval of advanced directives. With this, mental health care management system was planned. And this had a key features of importantly user-friendly for all stakeholders, like for patients, for service providers, for mental health establishment, mental health authority, and also mental health review board. And the records to be kept in a secured platform. Initially, it starts with the process of registration of all stakeholders. Basically, they need to have a unique login and ID. Patients, service provider, regulators like Mental Health Review Board and Mental Health Authority. Once the Mental Authority approves, the linking of the system starts. Once the linking of the system starts, the basic medical records and the data will be kept in a secure platform. And the additional feature of regulating this Mental Health Care Act comes into picture. And this is the functional block of the applications. If you look at the center, the heart and soul of the whole application is Karnataka Mental Health Data Registry and Repository, which is managed by State Mental Health Authority and regulated by Mental Health Review Board. And it has various features. We will discuss this one after the other. And this beta version was released by none other than our Health Secretary Javed Akhtarji on 23rd to 25th August when CANSIPS, that is Karnataka Annual Conference of Indian Psychiatric Society, it was beta version was released, and it was named as e-Manas at that time. Coming to the first module, Mental Health Professional Register. It is basically mental health professionals like psychiatrists from other systems like Ayurveda, Unani, Ayush, psychologist, psychiatric social worker, psychiatric nurses have to register themselves under the State Mental Health Authority, and that is done through this portal. And a unique login and ID will be provided to each professionals. And also they can update their whereabouts, where they are practicing and which hospital they are going. And these need to be validated by State Mental Health Authority. If you look at the Mental Health Establishment Register, all establishment where the patient is going to be kept overnight needs to be registered. It can be government, it can be private, or it can be any trust or called by any name, has to be registered. Registration can be provisional initially and then it becomes permanent. And in this establishment, whoever the mental health professionals are going to work will again develop their own unique ID under the establishments. Coming to the service user, basically patients, for them also the grievance and complaints can be registered through this portal. At the same time, their rights, how to register their advanced directives, nominated representative, and they can find where are these mental health establishment, where are the services available under the mental health professionals, and what are the services. Those will be available under this portal. Further, Mental Health Review Board, a quasi-judicial body under the Mental Health Care Act. These board members will have a unique login and ID. They will monitor the registration, storage, and retrieval of advanced directives. At the same time, if anybody challenges this advanced directive, review and editing of the advanced directive is done by the Mental Health Review Board. Not only the nominated representative, the person who is nominated by the persons with mental illness also reviewed by the Mental Health Review Board. All supported admissions, that is involuntary admissions, and admission of minors under section 86, 89 and 90 will be monitored by the Mental Health Review Board. Further, if the patient grievance or any complaints with regard to the violation of rights will be taken by the Mental Health Review Board, which is a quasi-judicial body under the Mental Health Care Act. Coming to Mental Health Authority, this is nothing but an executive body which is going to implement the Mental Health Care Act, which is going to look into the OP services, inpatient services, basic medical record, psychological assessment reports, therapy sessions, and full compliance of Mental Health Care Act lies under the Mental Health Authority. The State Mental Authority legal representative is CEO, who is going to be the commissioner from the state of Karnataka, that is Commissioner of Health. Moving to EHR, Data Registry and Repository. Here the registration of all severe mental disorders will be done. Mechanism of reminding the follow-up for SMDs will be done either by SMS or by a phone call. If they don't come, a CADS will be done, that is care at doorsteps. The DMHP team will visit their house. If required, medicines will be given, and if there are any difficulties, will be tried to be sorted out. And helpline 104 and 108 will be integrated with this portal. Coming to the management of advanced directives, this is as per the Mental Health Care Act. Every person has a right to make advanced directives. How he has to be treated and how he is not supposed to be treated. Access and privileges of these ADs and NR will be managed at the portal. Confidentiality, consent, all those will come under the AD. That is Portal for Advanced Directives. Coming to the EHR, basically e-hospitals, that is Arogya Karnataka, connecting all public mental health systems along with general hospitals. district hospitals, medical colleges, and even the community health centers. Not only that, all private mental health establishments will be connected. This platform will be given free of cost to them. At the same time, they have to make efforts to take up the APIs, and the data can be seamlessly transferred to the Karnataka State Mental Health Management System. And further, institutions like NIMANS and DIMANS also need to, what we call it as API provided, should be taken, and the data transference should be done seamlessly with synchronization. And this portal was recently released by our Honorable Chief Minister, Shri B.S. Yediyurappa on 26 June 2020. And it was a proud moment for Karnataka State, because this mental health management system is seen by one of the innovative of Karnataka State government. During this release, even our Shri D.V. Sadanand Gowdaji, Honorable Minister of Chemicals and Fertilizers, Government of India, was also present. And these are the various participants who were present online. In spite of pandemic, and because of the pandemic, there will be a lot of mental health problems. For this mental health management system, e-Manas was released at the earliest. If you like this video, please do subscribe to my channel and also press bell icon for notification. Thank you very much.